Hello. COVID-19 was a defining event of 2020. Every region and every country has managed the spread of coronavirus in a very different way. Quite rightly, the outcomes will also be different. Today, we will see how COVID-19 has been managed in South Asia in general and what are the outcomes. Let's focus as far as the outcomes in respect of the active cases in South Asia. And I will now do a comparison of the active cases between October and November to outline what will be the trends possible in the month of December. India, which saw a high number of cases, in fact, the second highest in the world, about 9 million plus total cases, has seen a considerable drop in the number of active cases in the month of November. If we compare the numbers from 1st of November to 30th November, there will be a very dramatic drop of almost over 10,000 plus active cases in India on a daily basis. Other countries in South Asia have not been that fortunate or not been that effective, one would say. Particularly Pakistan has seen a very dramatic rise in the number of active cases in the month of November, which is almost from 12,592 on 1st of November, it has gone up to 48,000 plus on 30th of November. This will be attributed to a number of factors. The government is attributing it to the opposition jalsas or the opposition meetings that were held through the month of October and November, which had large gatherings coming together. Hopefully, the management will be able to restrain these and COVID-19 cases will come down. A similar situation was observed in Afghanistan, which saw, though not that dramatic a rise, but there was definitely a rise by almost 2,000 cases, active cases from 1st to 30th of November. As far as Bangladesh is concerned, the number of active cases remained stable, or there was no significant addition or reduction. Now, that itself is a concern because one would hope that active cases will come down, whatever be the number of daily additional cases each day. A similar trend was also observed in Sri Lanka, which had seen a spike in the month of October. The number of active cases have remained around 6,000, and this is continuing to be a constant in November, so management will have to be more effective in December if these have to come down. As far as Nepal is concerned, I think Nepal has also achieved, in the same manner as India did, reduction of the number of active cases, which has come down to almost 20,000, from over 37,000 plus on 1st of November to 17,000. That means the management of the COVID-19 cases has been very effective as far as Nepal is concerned. In Myanmar, which has been a spike due to various factors, including the elections and campaigning, has maintained a degree of stability with only 1,000 numbers increasing from 1st to 30th of November. But let me remind you, is the second wave which is being experienced in Myanmar, which is even much stronger in terms of numbers than the first wave where the country did not see much impact of COVID-19. The Maldives, again, has seen only a marginal rise in the active cases in spite of opening up tourism. And of course, the South Asia's, the most effective case or the golden case is Bhutan, which has continued to maintain a very low level of active as well as daily increase in the number of cases, which has been a marked feature of the management in South Asia is concerned. Thank you for listening.